knock, knock.
Hi.
Hi, I'm Hannah. I'm going to be the nurse today. How are you feeling?
I'm good. Sore, but good.
Yeah. Okay, hand hygiene. And then I'm going to grab some gloves. And this is baby Olivia.
Yes,
correct?
it is.
Congratulations.
Thank you.
Is now an okay time for me to do an assessment on her?
Yeah, of course.
All right, awesome. I can grab her from here. Alrighty, and then this is going to be our hospital bassinet for the video. Alrighty, I'm gonna loosen this just a little bit so that I'll be able to get in there. And then I'm gonna start by listening when the baby is still calm. She doesn't like some of my assessments, so she might cry a little bit. But first, I'm going to listen to heart rate and respiratory rate for 1 minute each for the purposes of this video. I'm not going to stand here for a minute. And then I will also listen to heart and lung sounds. Alrighty, and heart rate is 140, which is within range. And respiratory rate is 42, which is also within the normal range. Lung sounds are clear. I'm not hearing any murmurs or any extra sounds, so that is great. And then while I have my stethoscope out, I'm also going to listen to her bowel sounds. And they're active in all 4 quadrants. Alright, this one the babies always hate. I gotta take her temperature. I'm gonna undo just a little bit and go right under the armpit. Make sure it is fully in there. Alrighty, and her temperature is 37.2, which is within the normal range of a newborn as well. I'm gonna unwrap her. Oh, look at all that movement. It looks like everything is spontaneously moving. She has great muscle tone. Everything's equal on both sides. Her color looks fantastic. I'm not seeing any signs of jaundice, any cyanosis, anything like that. So now I'll just do a little head to toe. So we'll move down. So I'm starting looking at her fontanelles, feeling her anterior and posterior, and then feeling down those suture lines. And then I'm not seeing anything that we call caput, so that's just swelling. Sometimes babies will get that from going through the birth canal and being there for a long time. She doesn't have that. And then a cephalohematoma, which is just a little bit of blood. It's on top of the skull, so it's not brain bleeding, but sometimes babies see that. But also, she doesn't have any, so that's great. And her fontanelles, those are those soft spots, are flat and soft, so that's what we want. We don't want to see them bulging or anything like that. And then sutures, so that's going to be what's like between the fontanelles. Sometimes they can the bones can be on top of each other. We don't want to see that. Hers are approximated, which means they're right up against each other, so that's exactly what we're looking for. Her face looks even, everything looks good. I'm also going to watch her respiratory effort before I do too much with her, and everything's looking great. I'm not seeing any major retraction, so that would be if her ribs are coming out and it's super big belly breathing. So newborns are belly breathers, so you'll see a little bit of it kind of coming in and out, but if it's a little bit more extreme, that would mean that she could be in respiratory distress. So that's something we would want to look out for, but she looks like she's breathing a-okay. And then I'm going to test her cap refill, and that looks great as well. So And then I'm going to check her ears. They're in line with her eyes. I'm not seeing any deformities, so everything looks great. When I check her eyes, her conjunctiva looks beautiful. I'm not seeing any yellowing, which could be a sign of jaundice. No discharge from the eyes, anything like that. I'm going to test patency of nostrils. There's a couple breaths on that side, a couple breaths on that side, and then I'm going to test her sucking reflex. Awesome. And her rooting reflex. So she should turn her head towards the side that I swiped. So those are both reflexes that are super helpful with feeding. So that's why we look for those ones. And I'm going to feel around, make sure it's moist, it's pink. I'm not feeling any cleft palate, so that is great. Moving on down to the neck. I'm going to feel, I'm not feeling any sort of bulges or anything. Then I'm going to test her motion, so I'm going to turn her head, and then her arm and leg go out, so that's our tonic neck reflex. Twist it the other way, and this side then comes out. And then our Moro reflex, I'm going to pull her arms up, and then they make a C, so that's also what we call a startle reflex, if you've heard of that. I'm going to check her chest. It's rising equally. She has 2 nipples and a little bit of breast tissue. That is normal in babies. It's just from the hormones still from mom, so that will go away in a little bit, but it's totally a normal finding. And I'm going to check her brachial pulses. They are strong and equal. Moving down to the hands, 1, 2, 3, 4, 5 fingers. 1, 2, 3, 4, 5 fingers on that side. Test palmar grasp, and she grabbed them very well. And then I'm just going to take a look at the hand, make sure we have 2 lines and not just 1, and 2 lines and not just 1. Oh, you're doing so good, Olivia. Alrighty, and I'm looking at the belly, making sure there's no distension, making sure the color looks great and everything is beautiful. And then I'm just gonna press, no tenderness, it's not firm, it's soft, so that's perfect. And I'm gonna undo her diaper and look at her umbilical cord site as well. And it's moist around the site. There's no redness, swelling, warmth. That could be a sign of infection, so we don't want to see that. But everything is looking good. Moving on down, we want to make sure she has a vaginal opening and make sure she has a patent anus, and she does. She does not have any bleeding right now, but a little bit of bleeding is called pseudomenses. That's also normal in babies, again, just like the hormonal shift that's happening right after birth. So if you see that, no reason to be alarmed. And then I'm going to test her femoral pulses. And they are strong and equal. Alrighty, hang on, Olivia, I'm almost done. Moving on down to the legs. And count 1, 2, 3, 4, 5 toes. 1, 2, 3, 4, 5 toes. Then I'm going to test our plantar grasp, and she wrapped her toes around, and plantar grasp, and she wrapped her toes around, and then Babinski, and they flare out, Babinski, and they flare out. I'm going to check around her hugs tag, so that's her security tag, in case nobody told you what that is. That's just for safety, make sure the babies don't go anywhere. And I'm not seeing any skin breakdown. We like to make sure that, you know, there's no skin breakdown around that tag, because we do have it on there relatively tight so that we can't slip it off. And then she has an identification band, which is perfect. That's what we want. And then I'm going to flip her over. I'm going to look, make sure her spine looks straight. I'm going to check for dimpling at the bottom here. She does not have a dimple. If there were to be a dimple, I would want to make sure that you could see the bottom and there's no hair, because not being able to see the bottom and having hair there could be a sign that it's a more serious problem, so you would want to alert the doctor and they would probably get an MRI. And then I'm just looking for any bruising, any birth trauma. I'm not seeing anything there, but if you see this like fine hair that's kind of all over, that's called lanugo. Totally normal in babies. It's something we see a lot. so that is expected. And it looks like she has a little bit of milia on her nose. So that's just those like little white spots that kind of, they look like little mini baby pimples.
Yeah, okay.
Those are normal as well. I think they're so cute on the nose. So, alrighty. And then while I'm wrapping her up, I'm going to talk a little bit about our safety with sleeping. So it's our ABCs. So A is alone. We like to keep them alone in the bed,
Okay.
in the crib. B is for back. So we keep them on their back.
Okay.
And then C is crib. That's really the safest place to have them sleep. So we like to have them sleep in the crib. In the hospital, you'll notice we have this bulb syringe next door, so they're not completely alone in the crib, but the bulb syringe is to suction in case they need a little bit of airway clearance.
Okay.
So, has anyone taught you how to use the bulb syringe yet?
Yes.
Okay, awesome. And then you are breastfeeding her.
Yes.
Correct. Okay. It looks like she's showing a couple of signs of being ready to eat.
Yes, I
so
think
would
it's
you
about
be-
that time.
Awesome. And how has breastfeeding been going for
It
you?
seems like it's going good. She's got a
Okay.
good strong latch, so.
Awesome. That's great to hear. So I can give her back to you, and you can start feeding her, and then I'll be back in a little bit to check and see how the feeding is going, and then just make sure I document how the feed goes and how her latch is looking for me.
Okay.
If you finish feeding or switch sides before I come back, would you mind just jotting down the time so we can document that?
I can do that.
Awesome. All right. Do you have any other questions for me?
I don't think so.
Alrighty. Congratulations. And I'll be
Thank
back
you.
to check on you in a little bit.
Thank you.